Personality Disorder Clusters by Kaitlyn Gonzalez. To begin, what are personality disorders? According to the DSM-5, the lead diagnostic tool published by the American Psychiatric Association, a personality disorder is an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment. It is critical to understand that personality disorders not only affect the person who has the condition, but those around them as well. The DSM-5 classifies 10 different types of personality disorders, each with unique characteristics, symptoms, treatment methods, and lifestyles. However, some share similar traits. How do medical professionals work to characterize these personality disorders? The creation of the 3 personality disorder clusters work to aid professionals to identify subgroups of individuals within the larger population who share similar patterns. Easy to remember, these clusters are labeled as A, B, and C. Let's take a deeper look at each cluster. Cluster A personality disorders are characterized by odd, eccentric thinking or behavior. In public eye, many individuals with cluster A personality disorders are labeled as weird or are socially outcasted. Examples of paranoia, lack of emotional responses, or frequent outlandish comments may land someone in this personality type cluster. However, those are representations, and the DSM-5 labels that very specific circumstances and tendencies that an individual must have in order to be diagnosed with a personality disorder. A mnemonic device that will help the remembrance of this cluster is the example, people sometimes say odd things. The P stands for paranoid personality disorder, the first S for schizoid personality disorder, and the second for schizotypal personality disorder. Cluster B personality disorders are characterized by dramatic, overly emotional, and unpredictable thinking or behavior. Those in Cluster B tend to be impulsive and erratic. Generally, many label these tendencies of those in Cluster B as rude or mean. This illustrates the importance of professionally analyzing psychological tendencies and seeking help instead of just judging. A mnemonic device that may help you remember these types is HAMP, like hand just with a B. So the H stands for histrionic personality disorder, the A for antisocial personality disorder, the N for narcissistic personality disorder, and the B for borderline personality disorder. Lastly, cluster C personality disorders are characterized by anxious, fearful thinking or behavior. These personality disorders are often confused to be other abnormalities or mental disorders. For example, the typical phrase, "Oh, I love to keep things orderly, I just can't deal with a messy room," is often labeled as OCD or obsessive compulsive disorder. However, that is a misconception, as obsessive compulsion disorder is it labels recurrent and persistent thoughts, urges, or images, experiencing disturbances and intrusive, unwanted thoughts that in most individuals cause marked anxiety or distress. This misrepresentation of orderliness as a form of OCD, a mental disorder, misconstrues the actual labeling, which is OCPD, obsessive compulsive personality disorder, which in fact is a pervasive pattern of preoccupation with orderliness, perfectionism, and mental interpersonal control at the expense of flexibility, beginning by early adulthood. The acronym AOD shows cluster C personalities, as the A shows avoidant personalities, OCPD is obsessive compulsive personality disorder, and the D stands for dependent personality disorder. Thanks to the DSM-5, we now have strict guidelines on what patterns, actions, and timelines fit into the box to what's considered a medical-based personality disorder. Misdiagnoses are better prohibited because of this textbook. With the 3 clusters and their mnemonic devices, a general understanding of personality disorders will aid you in your future understanding of abnormal psychological behaviors. Thank you.